Good evening, Dr. Emre.
Hi.
It's very nice to meet you in Istanbul, and thank you very much for all the patients.
Thanks for having me.
To tell you the truth, you are my favorite doctor for the facelifting.
Really? I'm very shy and proud of this. Thank you.
Yes. When I first saw your work before and after of your patients, I called some patients because I didn't believe that it is the truth. I thought that it is a Photoshop. After that, I discussed with the patient and I believed that it is true, and after that we started
Yes,
to increase
I try
our
to do my
cooperation.
best, that's all.
Yes. Can you tell me more about the facelifting? What kind of techniques do you use?
Facial surgery is just a rejuvenation surgery. It makes not a different people or individual from you, just a better version of you. You know, the face is sagging during years, and we make the clocks a little bit reverse. Mostly we make the face, bring the face in a higher position, so the patient in his or her younger age. We not do only the facelift, also as a holistic approach, we do also neck lift. Maybe if we do it together, it makes more sense and more beneficial for the patients. The technique I used is mostly the plane technique. And Russia, they know it about SMAS lifting. We lift the SMAS tissue in a higher position, so the cheek is higher, which makes a youthful appearance or look. And also we also make the platysma muscle higher in the back position, which makes the neck area looks younger. This technique is more detailed technique than the other facelift techniques. I don't use the other facelift techniques because these are less beneficial for the patients. They are less invasive but less beneficial. That's it.
And what is your medical background? How many years do you practice facelifting?
I'm a plastic surgeon for 21 years. That was 6 years of residency. I mean, we study or we learn the operations. And the next 15 years is just practice. I was work for the National Health Services in Turkey, but I quit my job and career in the university and have a private practice in the plastic surgery field. Most of my operations are on face surgeries, especially face and neck lift. It is a little bit different than the other colleagues of mine, the other plastic surgeons, because my practice is 70% just face and neck lift and 30% just about body surgeries, body aesthetics. But it is different or controversial for other plastic surgeons. They do 7 to 8% for body surgery, body work, and just only 20% of facelift surgery. So I try to specialize on face surgery. I find myself always an apprentice. I have always tried to learn more, but most of my practice and mastery is about face.
And maybe do you use some new methods and technologies in faceliftings?
Technologies, we use endoscopic techniques, but it is very limited for patients. The patient's choice is very important in this area. The endoscopic technique is just for younger patients. Younger patients who wants or search for a fresher look. But for older age, as we age, we should use the classical or conventional facelift methods and also the neck lift methods. And sometimes we use also laser technology or laser technologies, but is also limited. Most of our work is just about traditional face and neck lift, which is more beneficial for our patients.
I see. And when you say about beneficial, what result we can expect after deep plane lifting? Maybe you can approximately say how many years the person will look younger.
It depends for the patient's inner clock. I mean to say, sometimes some individuals get elderly more quickly than the others, but the results are resistant to time, and it lasts at least 5 to 10 years. It depends on the patients.
So the patient will look younger, like 5 to 10 years approximately after the surgery. Than before the surgery.
I think you don't look younger. You look a better version of you. Okay. Okay. So your skin is more freshened. Your angles of face is more defined, and you look more defined and more not young, but more freshened. Okay. Comparing to your age.
I see. And can we see that? Can we say that the face characteristic change? I mean, it is not like put you 10 years ago, but it's a bit different.
Yeah, we can say that. You look, yes, you look younger, but in my opinion, you will look a better version of you. Okay, that's the point. And when you compare with your other people with your age, you look more different and than them. But and also I try to make it more natural. So why I am against fillers, because fillers makes you look a little bit weird. I don't like so much fillers. Just only I do fat filling in some cases.
And where is the scar after the surgery?
The scars is after the surgery under the chin and in front of the temple area, in front of the ear and back of the ear area. But which can be hidden with hair, or sometimes they will look only remarkable only for 3 months. It will be red, and then it will be whitened during time, and this is less visible for most of our patients, especially in Caucasian or European or Russian origin.
It is here, right?
Yes, the scars are not an issue. It's tolerated good and well by the patient. No one is claiming about the scars. Okay.
Maybe you use some tricks to reduce the scar appearance, or maybe to reduce...
Scar management is another issue, but the time heals mostly the scars, and we just only sometimes manage it with some creams and ointments, or pressure therapy or massage, and in some cases laser. But for most of our patients, the scar is not an issue after 3 to 4 months.
Does the patient require to repeat the facelifting, like in 15 years maybe, when he has again the sagging?
Every time revision is mandatory for all operations, and when the patients want a revision surgery, after 5 to 10 years, we can do one more revision for this surgery. I don't know.
I mean, the patient did the surgery. And in 10 years' time, the patient see that there is a new sagging after 10 years.
Sagging is an issue, but is less than the individuals who does not get operated. You sag less during time when you have a surgery.
But if the patient wants to do another correction to reduce the sagging in time, in 10, 15 years,
yeah, why not?
It is still possible. Is this surgery more complicated or it's less complicated?
Sometimes yes, sometimes not. It depends on the technique which is used in his previous or in her previous surgery. But Out of 3 patients of mine is revision cases, and I'm comfortable in most revisions. Sometimes it's more comfortable than primary surgery, because sometimes the planes are more visible for me. But always when I do a revision case, I take my cautions always.
And it is the same for the blepharoplasty. There can a new sagging appear, right, after the
Yes,
surgery?
this is adjuvant therapy. We add blepharoplasty to facelift. But most of our patients came to us with operated blepharoplasty operations, previous operations. So sometimes I do revisions, but sometimes I do not.
I see. Do you recommend to do a full facelift, a facelift with neck, or sometimes only half face is enough? How do you identify?
90% of our patients, my observation is, doing face and neck together is a better option and more beneficial than doing only face. Because when we only do face, the neck keeps on sagging, and when we do only neck, it is not. It's pointless, because neck and face age together.
Yes,
you know.
it's logical. How do you understand with the patient that it is a good time for the facelifting, or maybe it should be you should wait, you should apply cream or some cosmetology procedures?
I think first of all you should be healed inside. So the patient should eat healthy food. She or he should not smoke, consume alcohol less. That's the point, okay? When you're healthy, and then the facelift gives a better result. I mean, I do my patients, I select my patients mostly over 40 years of age. But the exact time for a facelift is, in my opinion, after 45 to 55. When the patients request in an older age a facelift, we can do also, but best results is in the age group of 45 to 55. But I can do all patients, maybe younger patients, or I also do older patients. It depends on the patient's will or desires, or dedication for this operation.
Maybe you have some advices for women who want to extend their beauty and stay younger for a long time without the surgery.
Most of my recommendations is about sun and smoking. You should protect yourself from the sun. Sun is our friend for the world, but also the foe of enemy of our skin. Okay, so you should wear always sunscreen before you go to outside, especially white patients, because skin damage is mostly seen in white patients, the European, Caucasian, or Russian origin. So you should protect you anyway, in any conditions from the sun. And smoking alcohol also makes some harms on the skin. So you should stop smoking or consuming alcohol, or never be in touch with them. Okay, that's the point. So eating healthy is also feeds the skin and makes your aging slower. So when you do this, and then if you come to me, I can help better. I give more benefits to you.
I see. And what do you think about the laser lifting? Because it's like a less invasive. And do you apply this technique?
I'm a fan of mostly unconditional surgeries, because lasers do treatments, superficial treatments, skin treatments, but making the face structures in a higher position makes only surgery in this in our time or in our recent knowledge. Sometimes you can use also energy-based products, etc., Aptera or some radio frequency devices. But this has less benefit than surgery. After the surgery, when you do this, the surgery benefits are more.
Maybe you have some recommendation to do before or after the surgery to get the better result.
I mean, in her 30s and 40s, patients have benefits more from these devices, or Botox, or protecting herself from the sun. But after 40s, the surgery helps more than this not less invasive methods. Okay.
I mean, maybe after the surgery, the patient should use
Yes,
additional
use,
cosmetology, radiofrequency of
skincare is most important thing after the surgery. You can have a good skincare. When you have a good skincare after the surgery, the results will last longer.
And what do you mean with good skincare?
First, I always say this, protection from the sun. And then you have also periodic skincare. You can use your skincare products.
Like hydration?
And also,
hydration?
Yes, you can use also this Aptera devices or energy-based devices, or laser treatments also you can do. Some touch with Botox also helps after the surgery. But most important thing is the sun. And you should eat healthy food. I mean, you should eat veggies more than the meat-based products or animal products. So you will be more healthier, and your skin is will be look healthier. Okay.
Does the amount of liquid that you drink during the day helps also to extend the skin youngness?
Yes, yes. You should nourish your skin. You should make it soft. You should hydrate your skin.
What are the
from inside and from outside.
I see. What are the advices do you give your patients after the surgery?
In the early period, they should rest because healing is having good rest. And then they should protect his or herself from the sun. That's the important thing. And always live a healthy life. That's my recommendation. Otherwise, we cannot stop the time.
Sure. And what are the restrictions after the surgery?
I have not so much restrictions, but in the first days, they don't should make fast movements. They should take a rest and simply sleep more for better healing. And then they should take the antibiotics and other medicines to heal properly. And then use scar management creams and avoid from the sun. You understand it that I always point out the sun.
Yes.
Sun is not our friend for our skin. You should have sun only for 15 minutes daily, and otherwise you should protect yourself.
And there is some limitations on the period of time when you do facelifting. For example, it is not probably recommended to do it in the summer.
You should be back to work after 2 weeks. When you have a body work, you should prolong your resting time for at least 1 month. I have not too much recommendation. Just don't get hit, don't get yourself damaged. That's it.
And when we can expect that the blues go on and we will look normal?
10 to 14 days. At least.
And the swelling,
yes.
So we can look more or less okay.
Most of swellings will fade away in 2 weeks, 60 or 70%. and the remaining swellings fade away in 1 year. But in 6 months, there is most our patients does not recognize the swellings.
I see. And sometimes it happens that there is some asymmetry after the surgery, or it is not
Our
the case?
faces are asymmetric, so the surgeries are asymmetric. No one is symmetric as a photo in our passports. Okay, and this is very how can I say very boring to see our face as a dish. So symmetry, a little bit symmetry makes you look better and beautiful.
So you keep, I mean, this asymmetry that was natural for
This
the
is not a
person.
symmetry surgery.
Yeah.
This is just a rejuvenation surgery. You look more youthful, but not symmetric.
I see.
No one is. Okay.
Yeah. And how many days the patient should stay in Istanbul for the whole period of surgery?
In my opinion, 10 days is optimum, but most of our patients can leave after 5 days because no one has time.
There is some other contraindication for the surgery besides cardiac problem and infectious
Yes,
disease.
we always make a search for the patient's other diseases. I want ideally my patients healthy, but most of our patients has also some chronic diseases. But we take cautions for them. I don't like to operate cardiac patients, but in some conditions, when they stop their blood thinning drugs, or when they have a report from the other doctors that they are healthy and suitable for the surgery, we can do in some conditions the surgery. Hypertension is also an issue, but we always try to make control the hypertension, and most of my patients has also hypertension, but we have not experienced so serious problems. But most important thing is blood thinners. Blood thinners makes sometimes problems for us.
Sure.
So they should stop it and should have recommendations from the original doctors. So I operate. Otherwise, I don't want to operate them for their goodness, of course.
Sure.
Diabetics also an issue, but in face the wound healing is not so bad as the other body areas. So diabetics under this, if their glucose level is under 200, we can operate. But we always make consultations before the surgery. So when the patients come 2 days or 3 days before the operation, these problematic patients, we can make their checkups. When they are healthy, we can operate them.
I see. And how many facelifting surgeries do you do per year, approximately?
I'm not counting, but last month I do 24 patients, and I cannot give a report for this month because the month is not ended. Over 200 patients,
200.
but I don't know the exact count numbers of our patients. Sometimes it depends, change for season or season, but over 20 I can say per month, average. This is a huge number for most of the patients. And you know, the surgery takes time and dedication. So I can operate 3 patients per day, but it's not appropriate. So I do operate 1 or 2 patients per day because it takes time, because details are very important in the surgery. It's not a McDonald's, hamburger making. It's just a haute couture. Yeah. You know, every patient is unique, and I try to give the enough time, sufficient time for my patients.
And how long the surgery lasts?
5 to 6 hours. It depends on the patient's conditions. But approximately 5 to 6 hours is a good time limit. Sometimes longer, but sometimes shorter. It depends on the patient's conditions. When there's a problem during the surgery, I don't go it before I fix it.
Thank you very much, Dr.
You're
Emre.
welcome.
It was very
You're welcome.
interesting talk. And
Well, thank you. Thanks for having me. I also enjoy the conversations. Thank you.
And thank you very much on behalf of our patients. Your results really are amazing.
Thanks a lot. I do my best, but no one is God.